Well, hey everyone, this is Daniel Williams, Senior Editor at MGMA, host of the MGMA Podcast Network. We are back today with another MGMA Insights Podcast. We've got Sarah Clark. She's a healthcare consultant, works with a lot of practices just like y'all listening. I didn't get to go to the MGMA Operations Conference recently, but a lot of my colleagues did, and they came back and said, you've got to have Sarah Clark on the podcast, and it worked just like that. Here we are. So, Sarah, I want to welcome you to the MGMA podcast.
Well, thank you for having me, Daniel. I'm happy to be here, and I'm glad that they reached out after the operations conference. And full transparency, I was excited to meet you, so I was attempting to stalk you at that conference anyway, just to say hi, because I had an appointment earlier this morning, and I'll throw on that podcast because my drive will be 30 to 40 minutes, and those fit in there kind of nicely to go, what do I need to learn about? Or what is this terrible trend that we're seeing right now that I need to make sure that I have a good grasp on? And your podcasts are on the favorite list.
Oh, well, gosh, thank you so much. So we're going to talk a lot about what you spoke about at our operations conference. I know not everybody was able to be there in person, so I want to give them a little bit of a glimpse there. But first, let's get to know you a little bit better. Tell us about Sarah Clark. What's your background? How'd you get into healthcare consulting?
Sure. So I think that my story is a little bit unique, and in that my background is actually in sports medicine, athletic training. So my undergraduate degree, I'm a certified athletic trainer. So anyone that watches sports, the person that gets injured on the field, person that runs out, sometimes with the water bottle, but usually with a funny looking fanny pack and some scissors, is that certified athletic trainer that's out there to take care of those urgent needs. So that's my undergraduate, and I have a master's degree in kinesiology from Indiana University as well. So I was on a clinical trajectory, and that's where my healthcare journey started. So I was in the athletic training realm forever, and I knew several doctors. My husband and I had an opportunity. We moved across the country. We lived in Southern California for a couple of years, and we ended up returning back. I'm based in Charlotte, North Carolina, and we ended up returning back to the area. And I reached out to a couple of doctors and said, hey, I'm coming back to town. If you know any clinical positions that are open, would you mind passing my resume around? And a couple said, sure. And one said, no. Oh. And I thought, well, what happened? I thought we had a good relationship. He said, I need an office manager and I want you to do it. And I said, well, that doesn't start with clinical. So could you tell me a little bit more about it? So we came to an understanding and we came to an agreement, and I went to work for him. And it turned out that I was pretty good in the role. I helped him. I was able to, he had 5 locations, and then I ended up working for that one location and then working with the managers at the other locations, and had some little bit of advanced tasks like understanding the EMR system and helping to develop templates and workplace efficiencies. And it just sort of evolved that way. And so accidentally, I got into that. And then when that practice decided to join a super group that didn't have a really well-defined central office, myself and their business partner really helped to take that central business office to the next level. And I was a director of operations for that practice there. So I sort of worked myself up, just understanding what needed to be there. And maybe that clinical role helped me because I understood that background of what really was going on in the clinic, having been on that side of things. And at the end of 2019, I decided that I had done all that I was capable to do in that organization and was going to move on. And in that interim time frame, it was around the holidays, I got a few phone calls from some of the doctors that I knew that said, hey, we have this little project at the end of the year. Could you help us with that? Sure. And then there was 3, and I thought, well, universe is sending me something. Maybe I'll
Right.
just give this a shot. And then basically I started Sarah Clark Consulting
Okay.
from the coffee shop nearby on Christmas Eve morning, and that's what happened. But basically, my journey started because of a passion within healthcare and
Yeah.
making things be more efficient.
Yeah. Thank you so much for sharing that. I did want to follow up. I wanted to go back in time because you really piqued my interest with the athletic training background. You got the master's degree in Indiana. Was your undergraduate also there? Where was the undergraduate from?
I did undergraduate at Elmira College, which is a small liberal arts college in upstate New York in the Cornell area.
Okay. Okay. Very cool. Well, that is so neat. Offline, I could talk to you for hours about that and just pick your brain about being a trainer and working with sports. And that's so cool. So congrats to you on that role. And then moving on to the consulting side. So where we cross paths or got to know each other is through your affiliation with MGMA. You said you were an MGMA member.
Mhm.
You've now spoken at an MGMA conference, the operations conference that we had outside of Chicago. Is that the best way to put that? I'm not sure.
Yeah, it was
Chicago adjacent.
a little suburb of Chicago, which had plenty to do. So
Yeah,
I think it was it was less overwhelming, I think, than downtown Chicago
for
for some
sure.
people traveling. Yeah.
Yeah, that's so neat. So what you did, I just want to share this with everybody because I am telling you this because this is what everybody came back and told me who was in attendance. You just really wowed them with your talk. People really gravitated to it. And you talked about, let me get this right, the 4 Ps to success. So tell us just the elevator pitch. What are the 4 Ps?
Well, thank you for saying those kind words. It's
Yeah.
nice to hear the feedback. That was my first national organization
Okay.
to speak at. I've done multitude of other things, but in the national realm. So that's really nice to hear
Yeah.
that feedback. But basically, the 4 Ps for me, and this is what I put out there is people, patients, paperwork, and processes. So people are your team, right? The lifeblood of the practice. And that's all of the people, the
Hmm.
provider, the operations person, the front desk person, the biller, whoever, any clinical staff on there. Patients, obviously, the reason that practices are in business, right, is to serve the patients. Processes being those systems and the workflows that really keep things running smoothly. And paperwork is all the other stuff, all the documentation, the technical things, right? It used to be just physical paper and you have to do it. And now there's so much technology that's out there that's coming along. So I put um, the paperwork is all the technology documentation that really support the daily operations that go along. And we really want to have those four things in harmony together to create an efficient practice that's highly effective and then can have some compassion inside it along the way. Because sometimes those processes take out that kindness and compassion comment or component of it, and I try to bring that back in.
Yeah. Hearing you talk about it, it sounds so easy, but we know anybody who's worked in a practice, me having interviewed a lot of people in practices, it is not easy. I don't know where you have, come in to access this methodology, these 4 Ps, and getting them to work in harmony. But first of all, why is it so difficult to make them work in harmony? So let's just start there. We'll start with the negative, and then we'll work our way up to making it work and provide some solutions to our listeners.
Yeah, I think what makes it so difficult, Daniel, is that everybody, and this is not just medical, right? This is across the board and people that have businesses. We are doing the work that makes it run every day, but it's hard to take that step back, let alone take a half a day once a month to work on the business, not just like in it, right? We
Mm-hmm.
need to work on those things, and it's really difficult to take time out because the doctor is thinking about all the things that he has to do. And if they participate in insurance for reimbursements, I know that I need to see this number of patients and I have to do this and I have to do that. And whoever is sitting at the front desk should know what to do. And it just gets, we don't make it a priority.
Okay.
I think like we're busy and it's hard because there's the front office and there's the back office and there's a lot of disconnect between the two. And I wrote a little blog about like, I call it the sticky note escapades, right? It's like, there's a sticky note everywhere, but if a sticky note that's a really important one falls behind the computer, behind the desk, and it never makes its way around to whatever is supposed to happen, there's a lot of blame that happens. And I think it's just like, in any relationship, you have to work on it and you have to take time to have continuing education. That's for everybody. Things change all the time, right? Things are changing, especially after the pandemic. That technology that was just sitting on the edge and waiting for somebody to want it is now everywhere, and there's overload of it and it updates all the time. And how do you know when to pull the plug or not pull the plug or use it, and who's going to take the time to investigate it because nobody has the time to investigate it. And that's kind of where I come in. And when I say I work with small practices, maybe some people might consider it micro practice. Okay. I work with between 1 and 5 providers.
Oh, wow. Okay.
Because when for myself, when I find you get more than 5 providers, love all the providers, but it can be like herding cats, especially if they're all partners when you want to make change. So my ideal client is somebody that they want to make change. They don't know what they need to do, but they know they need to do something because they're feeling that burnout kind of feeling, and that sort of thing goes along. So it's hard all around. And I try to bring that in and I think it's good for some practices to bring not necessarily me, but somebody from the outside to look at what's going on in their practice, to see it with fresh eyes and let them manage that project for the office and become a trusted member of their team and just outsourced. And a lot of people can't afford to bring in a practice administrator when they're that size.
Yeah. You brought up so many different topics I want to follow up on, so I'm going to kind of compartmentalize them in my brain right now as we're talking in real time. And where I want to come back to, you really made an interesting point. So you were talking about the back office, the front office, we're talking about all the different people that are in these different processes. Where my brain went was the silos that we wind up in, because if I'm doing the coding, the billing and all those things, that's where I'm focused. If I'm over here seeing the patients, this is where I'm focused. If I'm greeting people at the front desk, that's where my focus is. We've been talking about this a lot internally at MGMA. How do we help get people out of silos in these more, as you were calling them, a micro practice, a smaller practice, where people do wear a lot of different hats? It might not be as prevalent as it would be in a larger practice where this is my only role. This is what I do. That's what they do. But how are you helping people not think about, well, this is the thing I do, but I'm not as concerned just because I am just putting out these fires all day. I'm not as concerned with what everybody else is doing. But do you get into silos at all, or is this resonating with you at all? Where would you say when we talk about silos and how do we get people out of those?
I definitely see that happen. And that's the people part of it, right? That's the people P that comes into play there. And really what I try to focus on is, yes, everybody has their main duty, right? The doctor is going to be the doctor. Yeah. They're not going to collect the payment, right, when the patient comes in, but they should know where their money lies and how to reconcile something at the end of the day. And that's one of the things that I see that's enormous, that physicians don't have a really good handle on that, because whoever is sitting at the front desk, they would never do anything wrong, right? But people do stuff wrong, right? And sometimes it's just bad math, right? It's just bad math, but you should have an idea on it. So one of the things that I incorporate when I do see that is I call it a morning huddle. Okay. And everybody gets together, right? 5, 6 minutes in the morning before you get started to really set the intention and the tone for the day. And it sounds a little new agey or whatever, but if you and I are in a practice together and on the way, actually, I'll give this example. On the way to the airport to fly out to Chicago for the MGMA conference, there's a lady, she gets on the shuttle from the parking garage over, and she sits down and we just chit chat. And she said, "Hey, would everybody mind if I could just be the first one off? I'm really running late for my flight." And we say, "Yep, go ahead. We're good." So she proceeds to tell us a story about, and she is wearing white. And she said, on my way, and she's got a coffee in her hand. She said, on my way, I was going to the gas station because I had extra time. When I'm at the gas station, the pump doesn't shut off and gas is flowing all over the place.
Oh my gosh.
Right? She somehow manages not to get it on her pants, but now she's running late for her day, right? So if she's going into a doctor's office and she's already frazzled and she's got a lot going on, she didn't get anything on her clothes, but imagine if she spilled gasoline all over her clothes. Right. So by coming in and then saying, we're going to start with our huddle, tell everybody where you are standing emotionally, what's going on in your day, and do you have bandwidth that you could help someone, or do you need somebody to help you today, right? So she may have said, I need 10 extra minutes to sit down and get myself together before I get started. Daniel, could you answer the phones for me while I do that? Right. Yeah. And I might say, absolutely. As a matter of fact, why don't you go and grab some coffee for everyone? Here's $30 nowadays. For some coffees, but why don't you go out there, go grab yourself a cup of coffee. I've got you for an hour. Right. Go ahead and just take a minute, right? Or somebody might say, I've got to get these prior authorizations done. And somebody says, I finished up my stuff early today. Let's do that. Or, I'm really frazzled. I got a flat tire, or I got in a fight with my spouse, or I just woke up cranky today. Yeah. Right. Or I woke up fantastic and I ran a mile and I've got energy and I'm ready to go to help on. So just by acknowledging that we all have challenges in our roles, and that we're somebody else from outside of the office, that we come in and acknowledging that and saying, I could use a teeny tiny bit of help. Somebody offers a little bit of help. Right. And then that's generally outside of where they fall. Right. Mm-hmm. So really getting the people on. And I think for me, that kind of comes from my sports medicine background, is you are on a team. We all have certain things that are our priority. Right. The quarterback isn't going to be a receiver, is not going to, and is not going to be a defensive back. Yeah. Right. But we all depend on each other to get some things done. And if we can all work together, we also then get a little bit more empathy for the role that they're doing. But now, we're not going to tell the doctor, go ahead and take 30 minutes or an hour to the coffee shop because that doctor, but we can tell the patients, we're running a little bit behind. Okay. The doctor had something come up. Let's give that doctor 10 minutes, right, before we get started. Okay. So the patient care doesn't suffer. So I think it's just communication and the people P.
Right. Now, you brought up a fifth P. It's kind of like the fifth Beatle here. So the fifth P to me was priorities, prioritizing. So you may want to add that to your speech here. So talk about prioritizing the flow of the day, whether that's internally, externally, whatever it might be, and handling that in a way that helps the practice run more efficiently and gets everybody on the same page as well.
Yeah, I think I put that under our process or paperwork, kind of, right? But there certainly is a priority, and not everything is a fire. Yeah. But we tend to act as whatever comes now is the fire, right? Instead of let's concentrate on, let's get this thing done correctly. So generally, so all those sticky notes I talked about, right? Everybody's got them on the front of their computer back here. You don't see the other side of my office. Right? Take those, get a big, like an easel piece of paper, take all the sticky notes. I got to do this. I got to do this. I got to do this. And we make a, high priority,
Right.
like have to do, you know, it's not as urgent, right? And then kind of like the bottom of the list. And let's reorganize those sticky notes or those task lists to where they go and try to stay focused as best we can. And then schedule some time for those priorities. And priorities also involve setting boundaries.
Okay.
Right. And sometimes the boundary is to the patient, right? Or sometimes the boundary is in the office, like respecting an employee's lunchtime. Put up a sign that says we are closed from 12:30 to 1:30 so that our staff can take a break. Now, maybe lunch is only 30 minutes, right? The staff gets a nice 30-minute break. Maybe that other 30 minutes is to prepare for the afternoon or finish up some tasks.
Love that. Yeah.
Right? Because we don't want somebody to have a 1-hour lunch as a benefit for the office, but that entire lunch, somebody keeps going, hey, can you do this? Hey, can you do this? Oh, I'll just check the messages while I'm eating my sandwich, right? That's not really getting a nice break and then allowing that person to have some mental clarity to be able to start the afternoon back, because the morning could be challenging as well.
Yeah. I keep thinking of new P's here. So there's another one here. What
All
about
right.
now? This is part of the paperwork. This is part of the processes here, but it's pajama time. We hear about pajama time, and how do we work more efficiently through the team so that those docs and other people in the office aren't taking the work home with them? I know sometimes we all are in that place where, yeah, but this is an exception, but it's not going to be the everyday rule that we have where I'm going to go spend 3 more hours or however much more time at home, when really we need to be recharging the batteries and doing that.
Yeah, Daniel, it's a really good point. And I put pajama time. I understand it, right?
Yeah.
But it is just it's not healthy, and it's not actually, I don't think, making them more productive.
Right.
So what I try to do is figure out where those pain points are. What is it? I'm having too much pajama time. Okay. Why are we having too much pajama time? I have to recreate everything I do. I work a lot with podiatry. So let's just say you have an ingrown toenail, right? The procedure itself is the same thing every single time. The space changes, the medicine might change, the depth might change. Some things are going to change, but essentially that procedure is the same kind of procedure. You don't want to template notes to the extent that you're never changing anything, right? But for that code with that note, if there's a way that we can template the majority of the things and they alternate in medication, the issue that the patient is having, this is just like for the procedure. So if there's ways that we can, instead of them dictating something that takes 3 or 4 minutes for every single time, if we can get that down to 30 seconds or a minute, where they pull in that template or quick text or whatever the system is that it calls it, and then they're just updating laterality, the specific medication and the complaint for the patient and how it was bandaged and the aftercare for it, then we can decrease that. And if they're doing 4 of those every day and we just saved 20 minutes on those things specifically, that's a good thing. There's so much technology that's available of having a patient complete their paperwork ahead of time, but having the system that integrates it from the paperwork into their EMR system, where there's no scanning the paperwork, then asking the same questions. You're just confirming. It says you take these 3 medicines. Is that correct? Yes. You confirm it. It's in the system, right? The problems, or you stated this, or they can upload a picture of their insurance card, put some of those processes in place, and then we can decrease the pajama time. Now, if that just means the doctor schedules more patients in their day and they like to do their notes at home because they prefer to do that and that's how it works, then every practice is different, but there's definitely ways that we can make things more efficient. But change is hard. Change is
Hmm.
really hard. And when you ask, well, why do you do it that way? Because that's how we've always done it.
Yep.
Does it work for you? Well, not really. Okay, would you like to change it? Tell me some ideas that you have and whether we use those ideas or not.
Hmm.
But we've got an understanding of what is the pain point. Or I have one client that he loves to do his notes at home so he can see more patients and he chicken scratches it out and then he prefers to dictate. But he does have some of those quick texts, right? That he'll use some of those, but that's what he likes to do in a quiet time. He has an office at home and does that. But I think pajama time, it's not conducive to a healthy environment for a physician. And I guess really going to those conferences and understanding the changes that come for documentation purposes if they're accepting health insurance,
Right.
and having a good understanding, or having somebody in the office that has a good understanding of what that is to make sure that the documentation is meeting the coding guidelines.
Okay. As a final question, then, let's talk about a solution then. Maybe it's a first step, a next step that our listeners could take, because you've covered a lot of ground here. There's a lot to think about, and it's probably a lot of the things that our listeners are thinking about daily in their practices. So what's something that they can do? What's a first step they can take to implement these 4Ps, or however you want to shape this conversation?
Yeah, I think I've written down some ideas to myself. I think that there's got to be a balance between all four or five or however many. But for me, for those 4Ps, there has to be a balance.
Right.
And so the listeners of the podcast need to understand that sometimes something might take a little bit more work than others, right? If you've got really good culture and you've got a really good team and they're comfortable in there, ask them what's good, what's bad. Ask the patients, what about your experience? There was a study MGMA did not too long ago that by focusing on your patient experience, revenue can increase between 10 to 30%.
Wow.
10 to
Okay.
30%
It's
increase
incredible.
of what you already have
Hmm.
just by adding not really tools. Is there some expense to them? Sure. Is it going to be 30% of your revenue? Absolutely not. But if you can garner a little extra by improving how your patients are perceiving their visits. So ask the patients, those patient surveys aren't just to meet quality measure
Right.
obligations, right? Utilize them and ask them honestly, what could we do to improve your experience? And ask the staff, what could we do to improve your experience? Ask yourself, ask the providers, what can we do to improve the experience of everyone? And pick one thing.
Hmm.
Don't pick all the things, because then you'll get discouraged and you'll never
Right.
get anything. Well, we want to pick one thing, have a balance of it. Um, don't underestimate happy people, right? We joke, happy wife, happy life, but happy and engaged team,
Hmm.
that's a positive thing that goes around. And, that team could be, the secret weapon if everybody's happy together. So a nice little balance of things. And if you need to say no, learn how to say no, like I mentioned about just putting up a sign in there, but something easy. If you've got a process that's not working, one I find that's pretty common is end of day reconciliation. So if you have a process that's not working, grab a whiteboard, whatever it is, map out how you currently do it, find out where those bottlenecks are,
Okay.
and figure out what you can do. Add something in, remove something, change it completely, and then follow up to see, is this working? Did this make it better? We implemented something as simple as an Excel cash log for a client because they never knew how much they had in their cash box, how much they should keep. And then they were manually subtracting when they were making a deposit. It saved her 30 minutes at the end of the day from doing it because she knew how much she should have to start, how much she took in for the day, and it should total that. So she only had to add it the one time.
Wow.
And if it didn't match, we just had to count the change again and figure out where was that penny? What happened to that penny? So find one thing, map out what the process is, find where the bottleneck is, and just try some little solutions. But it just takes the effort, and you just have to make it a priority. Everybody's busy, but we just need to change it from I'm too busy to I want this to be a priority and look down the road to see how that can really help.
That is wonderful. Well, Sarah Clark of Sarah Clark Consulting, thank you so much for joining us on the MGMA podcast.
Thank you, Daniel. It was a dream for me to be here. I appreciate it. It's a pleasure speaking with you.
Well, that's wonderful. So everybody, that is going to do it for this episode. But just like Sarah Clark is a MGMA member, if you're an MGMA member, send me a note. I'll put my email in the episode show notes. I'll even say it right now, dwilliams@mgma.com. Send me a note. Let's get you on the show so we can hear your story as well, hear the story, the successes and the challenges of your practice. So until then, thank you for being an MGMA podcast listener.